About myself too, I guess. I think I've never really talked about myself in that sense. I've been out for close to 7 years now, and I'm not on hormones, surprisingly. So the thing is, I've never been tested for any sort of intersex condition which could be responsible for certain things. I have been checking up with my doctor to some degree. I mean, I guess at this point my health is okay, um, to a certain degree at least. So in that sense, I don't quite know because it's not just the fact that my voice is a bit deeper, which to some degree, of course, is what I managed to train it to personally, but it's also the fact that my looks. I mean, I don't think I particularly look very much, like my age, I suppose. But I do have more masculine features and such things. And to a certain degree, I'm not particularly sure, but it seems odd to me to a certain degree. Um, Right. So, I mean, there might be a good chance that I suffer from an intersex condition that hasn't been recognized, of course, but I don't particularly think that is the case. In that sense, I mean, I'm not a medical professional, but yeah, I suppose I have to get these things cleared up in the first place before I go on hormone treatment of any sort, or medical treatment in general, which of course I want to do. Um, I'm not particularly sure on how much I want to do, because the thing is, I think that trans people like myself in general, we get forced into a very specific path of way of how things are supposed to be, and health concerns and so on get um, sort of ignored, it seems, to a certain degree. So I mean, I have certain health concerns about going on hormones, of course, even though I would very much like to do that, and surgeries as well, and so on, right? And in that sense, I have to make a sort of decision on how much exactly I want to take and what doses I want to take, what how long I want to take it for, and such things, and what methods I want to use, and so on. So in that sense, I think that's something that medical professionals don't really talk about and um, consider so much with their transactional patients. And the second thing I think I want to talk about for a little bit on here, apart from talking about myself, is also the whole reason, I guess, as to why I created this account in the first place and now actually finally uploaded, I suppose. It's this whole thing that I believe I think I've never really been into this whole gender aspect, that how it stands now. I think I've certainly always tried to be very accepting and understanding of people, and to a certain degree, I really try to understand even Mogite gender and such things in the past. But at a certain point, you just simply start to see that certain things simply are not the same thing that you have, and the same condition that you have and that I have. And that's kind of where it started, in a sense. And really, what I want to find out is just simply what causes these things, what causes my thing, how we can group these together, and how we can, in a way, make categories of their own, and how we can treat these things, and how we can treat the social problems, and that type of thing. So that's kind of what I want to talk about on this channel. And of course, I'd love to talk to people that disagree with me. And again, I don't want this to be any sort of obligation. I simply, sometimes I feel like I need to record a video and I need to do this and that. And it seems odd to me to suppress that, to suppress that urge and to have it nag me anyways for the rest of the day. I think I'd rather just, in the sense, give in and have it done with and just have it out there. And I don't care, how many people watch this. Because in a sense, I think it's just important for me to speak my mind in a certain way. So, yeah. What might be important, I have changed my documents. I've changed them over a year ago. So, in that sense, I've done a lot in the first place. At this point. So, in that sense, I don't quite know sometimes, how to describe myself even, because I haven't taken the traditional path, I guess, right? Partly because, listening to myself and so on, even though I have a slightly weird voice. I do sound somewhat male-ish, I do believe that. And depending on your interpretation, but I'm able to sort of speak and to hear myself to a certain degree. And even looking at myself in the mirror, I'm able to do that to a certain degree, more so. And it's, fortunately, on a sort of natural way. So in that sense, I haven't been needing immediate treatment over the past few years. Of course, I do need treatment, but it's been easy enough for me, so to speak, to take my time with it, right? And of course, I don't want to overdo anything, because of course there are health consequences associated with all of these things, right? But yeah. Well, what I really noticed too is I'm ashamed of being a transsexual person more often than I'm not, and I wish that I didn't feel this way, because it's not just politically, that I think, oh, these people are going to think I'm an idiot, but it's just simply this whole aspect of just not wanting to be perceived, a certain way, and not politically, but just simply physically. I want people to see me as a male person, obviously, and it's frustrating to go into any sort of social setting and have those expectations not met, which still happens to me to a certain degree nowadays. So, of course that's frustrating, and of course in a way, that's why sometimes I just have to talk about these things. I just have to vent a little bit about these things and so on. Yeah, but that's a little bit about myself. And I do notice that these videos go into not rant, but rambling category, which I guess is partly to blame for that is the fact that I don't speak English natively. So in a sense, I think there's a lot of word salads coming out of my mouth sometimes. But yeah, I think it's good to have a platform like this and really, to just not care that much about it. And again, not to feel obligated specifically to do certain things and that type of thing, right? So I can just focus on these things and what I want to do, and I don't want to focus on rants and vents and, and these things. And whenever I feel like it, I'm just going to upload something like this and just have it up there, maybe tweet something like, yeah, I don't know, maybe it helps someone. And really, I don't really particularly even want this to be a blog type of content. It's more, again, this discussion-based content. But again, it's like I have my whole career and my whole thing, and I don't see this as part of it. This is just really, honestly, something that I can call a hobby, which is, doesn't affect many things in my life, which I don't have that many things that I can simply refer to as just hobbies, not involved in anything job-wise and so on. But really, I think this one is something like this. Yeah, anyway, so thanks for listening and goodbye.